Hello, I'm Jeannie Summerlin with the Alabama Department of Public Health Comprehensive Cancer Control Coalition. I'm joined by Dr. Karen Meneses, Associate Dean for Research in the School of Nursing and co-leader Cancer Control at the UAB Comprehensive Cancer Center. Today we're going to be talking about the late effects of Chemo Brain on cancer survivors. Thank you for joining us, Dr. Meneses.
Thank you.
Now, with cancer treatments and technologies improving, people are living much longer with a cancer diagnosis. But I keep hearing about the late effects of treatment and challenges associated with this. Can you talk about this a little bit?
Yes, well, the good news is that people are living longer with a cancer history. Late effects are those effects that occur as a result of treatment, chemotherapy, hormonal therapy, surgery and radiation therapy, or a combination of those. And these late effects can occur in any organ or system about a year after treatment has ended, and that's why they're called late effects. Now, Chemo Brain is one of the most distressing late effects after treatment has ended. It's most often associated with chemotherapy and hormonal therapy, and it is an area in which there is a growing concern among cancer survivors.
Now, you mentioned Chemo Brain. Tell us what that is.
Well, Chemo Brain is really a term used often by survivors, but the real term is that it's a cognitive change. It's a change in thinking. And most often what happens is that survivors may have just difficulty remembering. They may not remember where they placed their keys. They may not remember sometimes how to get to a place that they've been driving to for a long period of time. That can be distressing. They may also not be able to prioritize what they used to be able to do before cancer occurred. And that may be that they have a lot of things that they want to accomplish, but they have difficulty at times just getting through the day trying to accomplish those tasks. And the last area that is most distressing as far as Chemo Brain is concerned is difficulty in attending. So they may not be able to attend or focus their concentration on things that they used to be able to do. So for example, they might say, I can't read this book chapter the way I used to be able to do that. Or I can't read the newspaper. I have to look at it over and over and over again because that's a difficult time in terms of attending or concentrating.
Wow. What can someone do about Chemo Brain? Is there anything a survivor can do to make it better?
There are a number of things that can be done. First of all is to recognize that this may be a late effect. And it's not often recognizable because it is occurring at least a year, if not longer, after treatment. And survivors may not always associate that this late effect is a result of treatment. So that's the first thing. The second is to talk with their doctor. Very important to bring up this concern because there may be a number of other recommendations that can occur. The first is a cognitive prescription. And simply a prescription means thinking better and living better. So to ask oneself, am I sleeping okay? Because the less one sleeps, the worse one thinks. Eating better, looking at foods that are much more healthy for them, their fruits and their vegetables, and really fueling their body so that they can think better as well. The third is that sometimes survivors may experience anxiety and depression even a year after treatment or more has ended. And so these are two conditions that are clearly treatable, but at the same time can also interfere with the way one thinks. So those are areas that really need to be discussed first. What can I do in terms of living better? And there are other very important compensatory strategies, is what we call them. How do we compensate? First one might be just writing notes and writing a lot of notes to oneself. If someone has a smartphone, sending oneself a smartphone message or text on the smartphone. The third is also looking at what are the tasks that are most difficult to attend to. So for example, if writing a check or working out the checkbook is a cognitive concern and they're much brighter at the morning or afternoon or evening, choose that time of the day essentially to place that activity.
How long does Chemo Brain typically last?
It varies from every individual and from one individual to the next, even if someone has the same diagnosis and the same treatment as another individual. So survivors get a chance to compare their notes oftentimes about cognitive changes in Chemo Brain. But again, it is different from one person to the next. For one person it may last several years, and another person whose treatment has ended with hormonal therapy, Chemo Brain may actually decline or decrease after that treatment has been completed.
Now, I'm sure there are survivors that are concerned with Chemo Brain affecting their job responsibilities. What is the best way to address this?
Well, that's a very good question in bringing that up with their employer. If they so choose to disclose and they see that the Chemo Brain is distressing for them, particularly in the work environment, by all means have a discussion with their employer to talk about ways they may be able to accommodate the concerns and the activities that they have around Chemo Brain. So I'll give you an example. Many times people will just be at the desk and work all day long. That may not be the best thing for one's cognitive health. Maybe get up and take a break, 5-minute break or 10-minute break after a couple of hours or even 90 minutes of activity. Making sure that the survivor eats well as takes time for a lunch break or a dinner break or whatever occurs as well. And again, the last piece then is looking at those tasks that might be more challenging to accomplish those at the time of the day when they're actually much more active and thinking more clearly.
Is there somewhere someone can go to learn more about Chemo Brain?
There are a number of different websites that are available. The American Cancer Society, also the National Coalition of Cancer Survivors has terrific strategies that can be used, also through the cancer centers as well. This is a very recognized distressing late effect, and we are paying much more attention to this, particularly for survivors.
Now, Dr. Meneses, what would you say are the take-home points for the viewers?
First take-home point is that to recognize that that Chemo Brain or cognitive changes are occurring, that someone is not going crazy, because people will feel that. The second is there is help. There is help when they disclose, they talk about that, bring this to the attention of their doctor. And third, to also know that there is help among survivors and strategies and tips, and we're continuing to work in terms of research to better identify and to help treat Chemo Brain.
Thank you so much, Dr. Meneses, for joining us. And thank you also for viewing our segment on Chemo Brain.